Welcome to the AfriChild Centre, where we strive for an Africa where children's well-being is realized for sustainable development. The AfriChild Centre exists to generate research that informs policy and practice for the well-being of children.
Established in 2013, the AfriChild Centre exists to improve the lives of children across Africa. As an institution, our vision is to see an Africa where child well-being is realized for sustainable development. We recognize that across Africa, and specifically sub-Saharan Africa, children continue to face challenges across the domains of child health and survival, child protection, child development, and child participation. And as an institution, through research, our mission is to generate evidence that will improve practice and policy. We do this through rigorous research, capacity building, with an intention of building a cadre of researchers across Africa that will contribute to generating evidence to improve both practice and policy. But we are also intentional on our engagement at policy level, ensuring that research is undertaken with the intention of improving our legislative and policy frameworks. We are keen on partnerships. We believe that we cannot do this alone. We need to work closely and in collaboration with like-minded organizations, with partners, communities, and more especially with children involved in echoing and sharing the aspirations and the vision.
Join us in our mission to transform the lives of children across Africa. Together, we can make a lasting impact. To learn more about the AfriChild Centre and how you can support our work, visit our website or follow us on social media.
Good morning, good afternoon, and good evening, depending on where you are. Thank you for joining us today. Welcome to our webinar on integrating early childhood development monitoring in health systems. We'll be learning from our sisters and brothers in Kenya. My name is Claire Ahabwe-Banjirana. I work with the AfriChild Centre as the Director for Research and Knowledge Development. I'm happy to be your moderator this afternoon. We know from evidence that the first years of life lay the foundation for lifelong health, learning, and well-being. Yet too often, opportunities to identify developmental delays early and to connect families with the right support are missed. By embedding ECD monitoring in health systems, we can ensure that every child is not only surviving, but is truly thriving. Today, we'll explore practical strategies, lessons from the field, and innovative approaches that are making integration possible. Our speakers bring expertise from research, policy, and frontline implementation, and I'm excited for the discussion that's ahead of us today. Thank you for joining us for this important conversation. Let's get started, and I will go straight to introducing our speakers today. In the meantime, feel free to write your name and where you're joining from in the chat and ask any questions using the Q&A chat box. Our first speaker today is Dr. Margaret Nampijja. She's a medical doctor and research scientist in early childhood development. She works at the African Population and Health Research Centre in Nairobi, and previously served at the Medical Research Unit of the Uganda Virus Research Institute in Entebbe. She holds a medical degree from Makerere University and a PhD in developmental psychology from Lancaster University in the United Kingdom. She's an alumnus of the Wellcome Trust-funded postdoctoral fellowship and the African Research Excellence Fellowship. She's trained as one of the few clinical developmental psychologists in East Africa. It's such an honor to have you, Dr. Margaret Nampijja. Next, we have Ms. Linda Oloo. Linda is a research officer whose work mostly focuses on neurological and developmental outcomes of young children living in resource-poor urban settings and pastoral communities in rural Kenya. She has also successfully supported the conceptualization, design, and implementation of projects that improve the quality of childcare and women's economic outcomes in these settings. She's skilled in the co-design of practical and scalable intervention models and has also offered technical support to county governments in reviewing legislation and policies on childcare in Kenya. We are excited to hear from their rich expertise as they share with us this afternoon. Over to you, Dr. Margaret.
Thank you so much, Claire, for that very kind introduction. Kindly let me know. So thanks, everyone. I will just, before we get into talking about what we do at APHRC in the space of early childhood development, research, policy engagement, and improving services and practices, just let me tell you a bit about APHRC. So kindly help me share my slides. Okay, yeah. So next slide about APHRC, or the African Population and Health Research Center. So APHRC is an international research organization based in Nairobi, but with another station office in Senegal, in Dakar. And it is primarily a research institution focusing on generating evidence and also working with that evidence with the policy makers and practitioners, anyone, different stakeholders, to improve lives. So our vision is transforming lives in Africa through research, and accordingly, our mission, sorry about that. Our mission is generating evidence, strengthening research and related capacity in the Africa research and development ecosystem, and engaging with policy to inform action on health and development. So it's quite a mouthful, but that's what we do, and it's much bigger than just what the mission. Yeah, so how do we do it? Of course, obviously we undertake research. Our objectives are fourfold. One, to generate scientific knowledge in Africa, and secondly, to develop capacities to strengthen the research ecosystem within Africa, and thirdly, we want to use research evidence and engage policy actors for transformative change. And finally, but also very important, our fourth objective is to strengthen operational efficiencies in the systems of other organizations. As a fourth one that you see below was research. Programmatic area is research related capacity strengthening. You can call it training, but it goes beyond just training. And thirdly is policy engagement and communication. Like I mentioned earlier, we work with our evidence with the policymakers and stakeholder communities to ensure uptake and translation into real practices, real policies. And because we don't just write out publications or generate advanced knowledge or learning, but we want to see a change in the lives of Africans. So again, our research division, program that you saw, is further divided into four major thematic areas. We have the human development with the health and well-being, which deals, for example, with research in nutrition and food system, research in chronic diseases, management, health systems, strengthening, etc., and emerging and re-emerging diseases like the COVID-19. And then we have the second thematic area, which is human development, within which the early childhood development, or ECD, is located or hosted. And then we have the work on education and youth empowerment. And the third thematic area is the population dynamics and urbanization, and we have quite a portfolio of studies, units or programs also under this, including aging, work on studying the elderly and how are they supported, urbanization, health and demographic surveillances. So under this population and dynamics and urbanization, that's what we do. And then the final one, or the fourth one, data science. So within this, a lot of the time, people look at data science as just a support kind of a function, but within data science, there's so much that can be done to improve systems, to improve uptake, to improve what we deliver in the other areas. So we have measurement and impact evaluation, we have data science, we have projects that are dedicated within the data system. So there's much more beyond data that you can do as a researcher. And then next, so going down to the ECD work that we do, we focus on 3 major areas. The first one being improving childcare, whether at home or in daycare centers or childcare centers or even in early learning spaces. So we want to ensure that children receive the nurturing care every day of their life in every space, irrespective of their locations, irrespective of their socioeconomic status. So we do a lot of innovative projects. Some of them are interventions, others are only evaluating, or both. So that's in childcare patterns in Kenya, but also beyond the borders. And then the second area, focus area for early childhood development research is ECD integration, where we actually focus on promoting full integration, full monitoring of the child across the 5 areas of the nurturing care within the health system, because you may argue that health can only deal with nutrition needs and health needs of the child. But it is important that every day a child gets everything they need in all the spaces. So that's why these days we promote that even within hospitals, a child can get responsive care, can be protected, in addition to health and nutrition, can learn. And the caregivers can also benefit from, capacity building by the health providers, teaching them how to provide all the 5 areas of the nurturing care within the health system. And also it applies to monitoring the child, that you do not, limit monitoring of the child who has come to a health facility or who is out there being supported by CHP or community health volunteers with just nutrition and health. I mean, their development must be tracked, whether within the health or within the education system. So we focus on ensuring that all the time the child gets all the 5 areas monitored and also supported. But now this focuses more on integrating or strengthening integration of health ECD within the health system. And the third focus area within ECD is early childhood education. So we are speaking about early learning. A lot of the time, we may tend to think that learning begins when the child goes to school. That's not correct. As soon as they are able to understand, even within the mother's uterus, when they are still in utero, kids learn a lot. So that's why we encourage moms to speak to their babies in utero. But when they're out in the daycare centers, within their household, we build capacities. We sensitize parents and caregivers on what is that kids need to learn to be done for, so that you can stimulate their learning, you can provide the opportunities for them to learn even before they get onto the blackboard in the classroom. So we have many projects that we have done. So like I mentioned, our work really anchors or hinges a lot on the nurturing care framework. So in whatever we do, it's a cocktail or the nurturing. So just to tell you a little bit about a few examples of the projects or initiatives that we have done under each of the focus areas under ECD. So on improving informal daycare, quality of daycare in the slums, we know that there is poverty, but sometimes poverty is more concentrated in specific locations, like in the slums of Nairobi, where we find dire need for daycare. That's why we find most need of daycare, because they can't afford a maid, or they don't have one, or the kin are down there in the villages. So we find informal daycare. And when you speak about informal daycare, it's really poor quality. And so one of our works or pieces of work has really been to innovate models for improving low-cost models for improving the quality of care provided within these informal settlements. So we call that the community of practice, because it was co-created with the communities and supported within the health system, with the CHPs or community health promoters being at the forefront of the training. So in groups of daycare providers, they would supervise, but also give modules, like train them on the 5 areas and how we do give that, So that's one of the initiatives that we've done, and this was in Nairobi. Then under childcare patterns again, we have supported or enhanced caregiving practices in the rural Maasai. So this is not daycare, this is like home-based or household where in the Maasai setting of the children, and sometimes the moms have to go out and look for food. The fathers are far away, usually move with cows for a week or more, many weeks away out of the home. So it's a granny that's taking care of the kids. And when you dig deeper into that, there are gaps because Kajiados, a lot of them, a big proportion, are not on track. We are having malnutrition. Of course, we have the climatic, challenges, but there were gaps in the skills of these grannies. So one of our projects supported improving caregiving practices in the Maasai communities. And then, of course, beyond childcare, what else can we do to maximize the output or the impact of childcare initiatives? So the mom is the primary caregiver of the child. But while she does that, she may miss opportunities for employment. So we innovate. We've been very focused on both the mom and the child when we fund childcare. So how do we empower women economically through provision of affordable but quality childcare? So we have done work in that space and come up with very useful models that are low cost but have impact on improving both the moms and the child's outcomes. And finally, we're currently looking at what exactly does caregiver-child interaction do to the brain. So we have a neuroimaging project where we are doing MRI scans on children aged 6 months to 3 years and trying to measure the impact of positive interactions, of course, the other forms of interactions, to see how much, to what extent does responsive caregiving or warm parenting for the caregivers, both in the households and in the daycare, have on brain development. Next. Yeah, those are just 3 examples in that focus area. And in early childhood education, I mentioned promoting early learning even before formal schooling. So we have promoted and innovated or enhanced child-friendly or learner-friendly practices like the play-based learning or play-based pedagogy. So how do you play and learn? Because when kids are young, they're mostly playing, but how do you leverage play to promote learning? So how do you make sure that you're providing the different stimulation, the different materials, the different spaces? How do you make learning not laborious for the child who is still very young, but maximizing the input from the environment and whatever you're providing? So we did that in 3 counties in Kenya, and it worked very well. Of course, it included sensitizing and also training teachers on how they even can make locally made toys or play materials, and how they can actually convert what they were doing as classroom teaching. In the daycare, imagine, they were teaching them as kids, as students. So how do you convert that traditional teaching into learning through play or teaching play-based, pedagogy? And then, of course, we're currently looking at a project which is contextualized a leading project. And we also, we have profiled the needs and demand, the needs for children with disabilities. So as we speak about children, there are those that have been unfortunate, born with disabilities or acquired disabilities because of things that happen to them early in life. So we have specific innovations. We look at those within the bigger population, but also them as projects that really speak to their needs. So we have done that in one of the counties, again, in Kenya. Next. So, and one of the very important also, like the 2 others I mentioned, is the ECD integration within the health system. My colleague Linda is going to talk more about the project that we just completed in Nairobi, where we work together very closely with the policymakers, healthcare providers from at all levels to strengthen monitoring and provision of ECD all around, all aspects included within the health system. And as we speak, this project has actually aligned well with the governor's initiative to revamp ECD and make sure that all the areas of nurturing care are well catered for within all the different sectors. So, and then the second project that we are also currently undertaking is championing the centralized ECD data visualization platform for effective decision-making, monitoring performance on ECD for the country, and of course, ultimately improving service delivery. But the main goal is to ensure that all children receive what they are supposed to receive in terms of services and monitoring wherever they are, and no one is left behind, so that we can have exploit the full potential of every child in Kenya. And this is something that is being done in Kenya. I know something similar has been done by our colleagues in Tanzania, but we hope to see this done in all the countries in Africa, so that at one point we can actually put together all these indicators for children in Africa and say, I think this population, this proportion of children aged, say, 0 to 8, are achieving their developmental outcomes, goals, or so I think this is one of the flagship initiatives that can, impact the rest of Africa. Next slide. So those are the few, like I said, our work spans research, generating knowledge, but also using the knowledge to transform or to influence practices, service delivery, and policy. And what you see here is some of our team. I won't spend a lot of time, and you can see Linda already. So I give back to Linda, to Claire, and then to Linda. Thank you so much.
Thank you very much, Dr. Nampijja, for giving us an overview of the African Population and Health Research Center and all the work that you do. It's very inspiring, and we're happy to learn more about it. Now, I'd like to turn it over to Linda Oloo, who I talked about earlier, to tell us more, tell us what they're learning in integrating ECD in health systems, the practical strategies, the challenges, and everything else in between. Over to you, Linda.
Thank you, Claire, and good afternoon, everyone. I will be speaking about a pipeline project that we just completed. It's called the integration of ECD monitoring within the health system. I hope you can see my screen. So thank you for the opportunity, Claire and team, and welcome everyone. And we are glad that we have a good participant turnout for this webinar. So I will be speaking about a pipeline project. By pipeline, I mean that it was a small project that we did recently just completed. The title of this project is Integrating ECD Monitoring Within the Health System in the Low and Middle Income Settings, a case study in Kenya. So the rationale, the importance of early years, this is one of the building blocks of this project. We know that mortality for young children before their 5th birthday, especially in low-income countries, is quite high. And we also know that more than 150 million children do not get the opportunity to celebrate their milestones. And most of them are stunted, and at least 200 million children fail to reach their developmental potential each year. And we also know that nearly 1 billion children experience violence annually, and the burden of these adversities is disproportionate in resource-poor settings and also in low and middle income countries. So cost-effective strategic investments that are made during the early years can help in mitigating detrimental effects of poverty, social inequality and discrimination, which really compound and result in long-lasting problems. But if we invest early, we are able to gain and reap benefits for young children so that they're able to optimize their potential and live successful lives as youth, as adults, and also within families, communities, and countries. So why integration of ECD into the healthcare system? So we know how the healthcare system works, and we know that it is important to look beyond just the physical needs of young children so that children do not only survive, but they are also able to thrive and holistically achieve their developmental potentials right from day zero. Integration of ECD within the routine child health services is a great opportunity that can help in regularly providing monitoring services, and it can also optimize ECD outcomes by addressing all the developmental needs when we take advantage of the system that is well structured with personnel and also with the equipment. Therefore, promoting early intervention and improving overall child well-being can really work if we integrate ECD within the health system. Integration also provides a holistic approach to child development by addressing not only the physical needs, the physical health of children, but also looking at the cognitive, social, and emotional development needs of children, which are also critical in early learning. But now here is the gap. Despite the benefit of integrated and holistic ECD services, we know that many countries within the low income bracket continue to provide ECD services in a very, very fragmented manner. Kenya, we found out, is one of these countries. Healthcare system in sub-Saharan Africa also struggle to provide a complete package of ECD services for children across the nurturing care aspects, and the health sector tends to focus more on good health and nutrition services within the health system service provision. So partial monitoring and support of children's well-being and development undermines investment in specific intervention, as nurturing care framework components do not function in isolation, but rather they should complement each other. Consequently, we know that many children therefore are not able to achieve their developmental and educational outcomes, and therefore they may not really be very successful later in life. So the objectives of this work, the overall objective was to explore the existing ECD services and monitoring of indicators within the health system, existing gaps, and how ECD integration in the health system can be strengthened to optimize ECD outcomes in Kenya. Specifically, our first specific objective was to review literature on models or approaches that have been used previously for ECD integration in health system. Secondly, to understand existing ECD services and the gaps in monitoring, reporting, and supporting nurturing care framework and child outcomes. And thirdly, to co-create with government health stakeholders a model for full integration of ECD services, which includes the developmental milestones into the health system. So the methods that we used, this was a participatory cross-sectional qualitative study that was done in Nairobi City County in one of the sub-counties, one of the 17 sub-counties in Nairobi, which is called Ruaraka. And the participants were drawn from different sectors, but from within the health sector at the county, coming down to the community level. So we had county directors from the county level. We had partners that were working with the Department of Health or are working with the Department of Health. Specifically, we worked with UNICEF extensively. We also had healthcare providers at the hospitals and also managers and nurses and clinical officers. We had community health strategy teams, both at the county, sub-county and community level. And we also had community health assistants and promoters who primarily work in the community at the household level. Last but not least, we also included the primary caregivers. So these are parents, both mothers and fathers of young children drawn from the sub-county, as well as daycare center managers who also operate daycare centers within the study community, which is Ruaraka sub-county. So in terms of the workshops, this was primarily workshop engagement with the policy stakeholders. We convened 3 workshops, which we conducted sequentially. So the workshops were convened in a phased approach, where we held a first workshop with the community-based policy stakeholders. So this included the community health assistants, sub-county nutritionists, community health promoters, the mothers and fathers of young children, as well as daycare center providers from the community. The second workshop, building on the first workshop, brought together the county and sub-county health teams, health facility managers, and also partners such as UNICEF, like I mentioned. And then the third workshop was a joint stakeholder workshop that drew stakeholders from the first and the second workshop. And finally, we had a follow-up workshop after the joint workshop, which was to bring in the lessons and learnings from the previous workshops. But the next phase, we envision co-creation of a full integration model, looking for more funding and also widening our scope in terms of engagement with stakeholders based on the findings of this study. So our first workshop focused on what really is existing in terms of ECD monitoring and service provision within the health system, looking at what exists at the community level. So we were able to get learnings from the community health promoters who do regular visits, routine visits at household level, and who interact with children as well as their parents. And on a day-to-day basis, we were able to get their experiences on interacting with children, especially those with the delayed milestones, and how they are able to interact with those children and refer them. And we were also able to understand available structures and opportunities that exist at this level to support full integration of ECD. In the subsequent slides, we will present what came out from these workshops. In the second workshop that we held with policymakers from the county level, as well as from the partners, we sought to understand how what health policies exist, what plans, programs, and resources are provided for ECD monitoring and services, if at all there are, and also the gaps that are there with reference to the nurturing care framework. We were also focused on identifying opportunities for the achievement of full integration of ECD monitoring and services within the health programs, leveraging on the existing resources, such as the digital opportunities that they use at this level. So in the third workshop, which was a joint stakeholder workshop that brought county level stakeholders, sub-county level stakeholders, as well as community level stakeholders, our focus was to have a shared understanding of the outcomes from the first and the second workshops, which were held separately, and also to draw a way forward and actionable strategies that we can learn from in terms of moving forward to achieving full ECD integration across the health system using the nurturing care framework at all levels. So some of the results that we found at the implementer level, focusing on the community health promoters and also the community health assistants, interacting with parents and also interacting with daycare center providers, we found that most of the service provision focuses on the good health and nutrition. Looking at illnesses, referral systems, immunization, nutrition, anthropometry, and also reporting on children with disabilities is also common. Although we found that there's a gap in terms of skills on how to identify the various disabilities and also how to effectively report and refer these cases of disabilities and also delayed milestones. We found that there was a lot of support programs in terms of nutrition and immunization, including vitamin A and deworming, which included a lot of booster programs that are supported by the government, but also with partners. We also found that the reporting for indicators at this level is done electronically using the electronic community health information system, which feeds the data electronically. So these systems are such a good opportunity because they are dedicated to empower the healthcare system and also the community, as well as the community health promoters, through integration of health information for access and efficiency in service delivery. So in terms of opportunity, we feel like this digital technology can be leveraged to support in terms of monitoring of ECD indicators as we look at integration. In terms of the gaps at the implementer level, we found that there's limited tracking, referral and intervention for child safety and protection, responsive caregiving, early learning, and developmental milestones. Like I mentioned, a lot of focus is on good health and nutrition. There's also gaps at the health facility level in terms of detecting and provision of services. We found that we don't have personnel at these levels. We also don't have equipment in some of the facilities. So it's very difficult for children with the developmental milestones delay to be assisted in these facilities. We also found that there's a gap in terms of the capacity for community health promoters in terms of how to identify, how to advise, and how to refer children with developmental delays and also disabilities. They also lack tools and skills to monitor developmental milestones at the community level. At the policymakers level, we found that policymakers and health managers, they have training, but the training is not very sufficient. So there's still a gap in terms of doing training for everybody at this level, but they appreciated that there's an existence of gaps in the system. There's also a gap in terms of their capacity and the resources. We also found that certain aspects of the nurturing care framework, such as child protection and responsive caregiving and early learning, are a bit confusing because it is not really clear whose mandate is it when it comes to these components of the nurturing care framework. So the health sector tends to say that these are not within their mandate. And also early learning was perceived to fall under education, yet we know that basic education provides for children who are 4 years and above. So there's also a bit of confusion in that level. So in terms of recommendation for the gaps, for the incomplete package of the nurturing care for children who are under 3, the recommendation was that there's need to include other aspects of the nurturing care framework by working with other sectors on intervention, on measurement tools, and also on indicators so that the work can be done collaboratively rather than each sector working on its own. So on the gap of capacity of the workforce, this includes knowledge, skills, from the community health promoters going up. There's need for building of capacity at all cadres on the system. This can be done in collaboration with the government, but there was also a strong opinion that that partners can come in and support in terms of offering the capacity by giving training curriculums and also assisting with resources that can help in building the capacity. In terms of tools for measurement of indicators, there's need to expand tools to include missing indicators. And there was suggestion that AI can be leveraged to track developmental milestones and also existing records such as the mother and child reporting documentation has a component of reporting for developmental milestones, but yet these are not optimally utilized. So there was a suggestion that there's need to optimize existing resources, but also expand the tools to include missing indicators that can help in optimization of tracking of developmental milestones. In terms of reporting and referral systems for delays and disabilities, there was a recommendation that there's need to streamline reporting tools and the referral system so that one system feeds to the other seamlessly without confusion and without one system saying that they are not responsible for the other. In terms of coordination with other sectors, there was a recommendation that there's need for all sectors to work collaboratively, and also the issue about remuneration for community health promoters. As it is, they are given an allowance by the county government, and so it was recommended that for them to do this work, they need to be added a little bit in terms of remuneration, so that the work that they do can, even if we add them the work to do full monitoring of ECD outcomes, then it can cater for the work that will be added to them. So there was also the issue around budget allocation for ECD. This was recommended that there's need to expand on the budget and also to leverage the existing structures, programs and resources from partners. So in conclusion, promoting full integration of ECD within the mainstream healthcare system is important and timely. And one of the things that we found is that there's need for a mindset shift to go beyond just survival and physical development of young children. This can be achieved through engagement, dialogue with policymakers, healthcare providers, and partners to jointly appreciate the importance and also to identify and address the gaps and arrive at practical solutions that take into account how available resources can be utilized, how existing structures can be leveraged, and how digitalized data systems can work to improve the monitoring of ECD outcomes within the healthcare systems. The findings of this study, we feel, are therefore very useful and important as they will inform the next steps in co-designing a full integration model of ECD integration for Nairobi City County, which can work as a learning point for the other counties, for the other 46 counties in Kenya and even beyond. And in terms of what we suggested as a collaborative engagement with policy stakeholders as the next steps, there's need for multi-sectoral and partner coordination where all services are coordinated effectively. There's an urgent need for capacity building, especially for the community health promoters who are at the base, working day to day with the households and reporting primarily on what happens at the household level. There's need also to map and profile all daycare centers in Nairobi, also to fast track policies such as the child care facilities regulation for Nairobi City County, among other policies that can help in terms of integration of ECD, and also support from other sectors in terms of monitoring what goes on within the ECD space. At the higher level, there's need for provision of resources to support nurturing care framework. This should be from the government, but also from partners. Also to strengthen the monitoring and reporting tools of the nurturing care framework, the referral system, especially for children with delayed milestones, but also children that need urgent referral due to child safety issues. There's also need to expand on the human resources and also to appreciate awareness of the nurturing care framework and ultimately to have a well-documented guide or a well-documented guideline that will help in terms of learnings on how full integration of ECD within the health system should really look like. So in terms of our acknowledgements, we want to thank APHRC for the funding of the pipeline idea. We also want to thank policymakers and implementers who are part of this project, and also our partners such as UNICEF for the guidance and support during the project implementation, as well as AfriChild for the opportunity to share the findings of this study. Thank you very much. Back to you, Claire.
Sound is on.
Thank you very much, Linda. Thank you for sharing with us those insightful findings. And we agree with a lot. I'm sure in the chat, I'm hoping the chat is a buzz now. Those in the ECD space can agree with some of the similarities in our findings. At AfriChild, we conducted a study on the developmental delay and disability, and some of the capacity gaps you highlighted in your presentation are exactly what we found. So it's interesting how the contexts are similar and how the challenges are similar. We continue to look out for the questions, but as the participants think of their questions, I have one or two questions I'd like to pose. It's exciting and interesting and mind-opening to see how you have collaborated with government actors. So my first question is on what challenges have you experienced? How are you able? We know that our dear beloved government workers are overwhelmed with a heavy workload and multiple expectations from different corners. So we'd like you to speak more into how you have navigated some of the challenges around sustaining their interest ensuring they come, incentivizing their participation in these workshops and any other engagements, so that you end up with a product that is shared between APHRC and the government. That's one of the questions on my mind right now. If we have time for another, I'm happy to share, but if you'd like to take that, please go ahead. Linda or Dr. Nampijja.
Thank you, Claire. Maybe I can give it a shot and then Maggie can add something.
Okay, please.
So when we started this work, one of the things that we learned when we were doing the planning was that it was important to convene separate workshops. By convening separate workshops, we were able to take care of inclusivity by bringing people from the community and giving them their own space to talk freely without fear of intimidation from superior officials. So this gave us an opportunity to truly understand the situation that was existing within the community level, so that when we went to the next workshop, then we had a separate workshop with higher level officials. And they were also able to give us, we had a safe space where they were able to give us all the issues that they experienced. But I must mention that sometimes, as is common with government, we want to portray a picture that all is well at the onset. But then when you delve deeper, then people, when they feel safe, then they're able to bring some of these issues to the fore. And I think that was one of the things that we can say was a gain, because having separate workshops gave each group an opportunity to say the challenges that they have, and also to try and brainstorm for possible solutions at that level. Yeah, thanks.
Thank you very much.
I could add something, kindly. Yes, thanks, Linda, and thanks for that great presentation, and thanks, AfriChild, for this platform. Now, how we have managed, in addition to what Linda has shared, is even across our projects. So we try to collaborate and bring on board the government stakeholders and any other partners that should be involved as early as trying to understand what is the gap. So engaging them right from the start and making them realize where is the gap without making them feel as if you're blaming them or you're punching, holes in what they are doing. When they appreciate that we are all working together and it's for the best, for the benefit, in the best interest of the child for whom we work for, then of course they will see that in a positive way. And if you come off with an energy of no one is being judged here, we are working together, and we know that not one stakeholder can do everything or can see everything, and they actually appreciate that we can highlight things that maybe they are not seeing well. So when you come off early and also engage them and also get their buy-in from the start could be at inception of the idea or the conception of the whatever initiative. You'll walk along together very well, and even during the implementation of any initiative, as long as you have an equal partnership, you give them their role to play, they will be very receptive, and it's likely to last longer than just on the project. So that's what we have used, but also sharing with them what does that mean practically, because a lot of the time researchers, we see things from the research perspective without explaining or packaging it to the implementer, for example, the policymaker or the service healthcare provider. What does this mean? What does it bring back in terms of benefits or outcomes? So if you explicitly show to them how this improves their service, how this improves outcome in their understanding as them providing, then that really makes them even own it more. So yeah, that's.
Thank you very much. Thank you very much, Maggie, and Linda, for those insightful responses. We are blessed to have some government officials with us from Uganda. And I think what is done in Kenya can be borrowed to Uganda or by Uganda. Last week, there was a running joke in Kenya about Uganda being the 49th county. So you doing this research saves us from doing the same, because the findings can be applied. So we'd like to hear from someone from the Basic Education Department. I believe that's Abdul Malik. You have your hand up. Would you like to unmute and ask?
Yes, thank you, Claire, and thank you, Doctor, for the presentation. While you were presenting, you did mention about childcare. As you are aware, childcare is a global good. In Uganda, we have challenges related to childcare because of working in silos. Now, my question is, how are you handling the aspect of childcare in Kenya? Do you have training modules? Are the people who handle childcare, are they well trained? Do they have certificates? How are you going about with it? Because here in Uganda, we have a challenge. Thank you.
Thank you.
I could take that. Or are they asking more questions?
Please go ahead
Claire,
and take. We look out for more questions.
just quickly, my response is childcare, in as much as it has been around as long as we have been alive as human beings, is still an area where a lot is needed. Of course, a lot is being done, but more is expected. So I want to come from above that it starts with a policy. If there is a policy on childcare in any country, and a policy that's not just in a document, but has also implementation guidelines, that will help a lot. But that's not enough. Again, the policy has to be implemented, but also government supporting and making sure that the implementation is smooth and makes sense at the where it's supposed to be implemented. So in Kenya, over the past, I think 1.5 years, there's been really in developing policies. You know, counties develop their policies. So at least Nairobi and a few other counties have come out to say, what do we need in terms of childcare? What are the standards? And when you talk about standards, then you're talking about measurement tools. And when you talk about measurement tools, when you're talking about capacity, and if you're talking about quality, then you have to demonstrate what it is. So they are actually also, in addition to policies, thinking along that way of implementation that makes sense, but also supporting. For example, currently the governance project is going to provide play spaces, but also build what you'd call like seed, I could call them seed or demonstration ECD or childcare centers. So there's a difference between ECD and childcare. So you have to demonstrate what quality is, and you have to provide the tools. You have to train people. So we hope that it will go that way. But currently, daycare is something that's highly on demand, and yet, of course, unfortunately, in the low income context, like in the urban informal settlements, the slums, I'm just avoiding that word, it's still really an appalling state where you wake up and in a household, a daycare has someone just, provides space. There's no quality at all. They're not trained, but there is a need. You don't blame them because there is a demand. There's a need, a genuine demand. And those low income moms, that's what is available to them. So, but the policy is going to help that. So also the partners are persuading the policymakers not to come with a police of just closing those who are not meeting the standards, but see how can government support improving standard. It could be through training, could be through bringing together the daycare providers so that they can enhance, as in like groups, enhance, or through circles, just provide that which the standards require. But it's still a problem, and I think it's not only a problem of Kenya, it's also elsewhere, because wherever there is a child, there is a need for daycare. So, but policy and also its effective implementation with a positive thinking of supporting those, because the need will always be there. Over. Thank you.
Thank you very much. We have a few more questions. Jude Okeria says he did not hear a recommendation on policy advocacy. I thought I had something on policy dialogue in the recommendations, but you can speak more to that. Let me read Jude's questions, and then you'll take those at once in one go. He also says that this is more of a comment, the nurturing care framework should incorporate a curriculum that addresses children with developmental difficulties, including mental health. But he also says play-based learning stimulates children's developmental abilities. However, sometimes children are given knowledge beyond their age because the facilitators are not well trained. How do you monitor the level of knowledge that children are exposed to? If you don't mind, I can also read the next set of questions. I think Aspa is from Addis. Then you can take all of them in one go as we move towards bringing this to a close. Aspa says, thank you, great presentations and insights. I have a couple of questions. The nurturing care framework requires coordination with other sectors, including data collection. How do you foresee this happening, especially if there's to be a centralized ECD data visualization platform? Can you elaborate on how you defined or identified low and middle income settings? And lastly, can you share some reflections on how responsive caregiving is presented and measured, and does it consider indigenous caregiving? Over to you, Linda and Margaret.
I could go first, and Linda will take some of those. I'll leave. I mean, those that were speaking to my presentation. And so one question is, I'll not go in order because I tend to forget. But the question on how do we get nurturing care requires that different sectors, because nurturing care is divided by different sectors, to work together right from data collection. So how is that going to be possible? That will be possible. They do not have to, I mean, for example, you don't have to take what the child receives from the hospital to the school. Some of it, of course, you can. For example, school feeding is where the health and education meet sometimes. So some of the things that can be done in the schools can be from another aspect of nurturing care would be provided. The way you want to promote deworming in the schools and school feeding and school mental health or school health, they can meet on specific things as much as that space can allow the other sector to actually be supported. And so that's one way of working together. And currently in Kenya, it works very well, especially with health and education, but there's still a gap. And those are the things that Linda spoke about. So the other opportunity where they can meet is at data. So within each sector and in whatever they are providing. And again, we kind of promote that they provide as much as is possible across the nurturing care and don't just narrow themselves to one thing. So at the data point where, for example, in education, the learning outcomes, or when they do the assessments for how are the kids learning, they have systems, they have data systems that track that. So the same to health, they have systems that track nutrition and immunization in health, diseases, mortality. So they have those data, but then they continue to work alongside each other, no one looking at the other. How are the kids we are teaching here? Are they healthy in health? So the data platform is another opportunity where the 3 or 4 different sectors can meet to see this child that they are all supporting holistically. So a centralized platform that pulls all the indicators together on one place can allow a health provider see what else is this child going through, how are they thriving and learning in addition to the immunization that you're giving or the feeding, if I'm coming from health. And the same for education. They can look beyond what they are doing, and including those that they are supporting for health, for example. So that's another area they can meet. And in Kenya, we have the Kenya integrated ECD policy, which, like you hear, it's integrated, speaking about everything a child needs, and also indicating or, specifying who is mandated to do that. And in the spirit of multi-sectoral coordination, which is also mentioned in the policy, sectors should work together as much as possible, even though there is a sector mandated for specific things, so they can still, like the way you take immunization into schools. So the health people are doing immunization, or trained teachers could give deworming tablets. So there's more to do. So there are several opportunities. They do not have to take the hospitals to the schools, or they do not, health workers do not have to go into the schools and station themselves there. So there are many ways they can meet, but data is one of them. And also provision of specific services is another one. And the policy then is a meeting point. Over. And maybe the other question that was asked was, we didn't hear anything on how we are driving the agenda together with policy. I think we mentioned that, but what you saw in Linda's presentation, the majority minus UNICEF, all the stakeholders, participants who are policymakers, were either implementers or policymakers, and at the end of the project, minus the earlier interactions with them, there was a dissemination, of course, and translation as what does this mean? And that's what she presented as next steps, and they were all committed to take those forward. And as I speak now, there is a program to really to take ECD or integrated approach on ECD across the county through the 3 different sectors, and this is being championed by the governor. So yeah. Thanks.
Linda, are you coming in, or should I read another question?
Yeah, so maybe I think I could just add the question on play-based learning, how it stimulates children's developmental abilities, but then the gap, sometimes children are given knowledge beyond their age because the facilitators are not well trained. So how do we monitor the level of knowledge that children are exposed to? I think this is a very good question, and we can take it forward in our further discussions. Because like Dr. Margaret has mentioned, the challenge that we have currently is that we have several non-informal, by non-informal I mean non-informal daycare centers where the providers are not really trained. And also I think we still have a challenge of a uniform curriculum for the children within the informal daycare centers. So it may be difficult to have knowledge for the daycare service providers because some of them are really not trained. So they are providing services based on what they know rather than having knowledge that comes from a curriculum. So I think this is some of the things that we can take forward in our discussions. If you allow us, because I think I really don't have an answer to it as it is, but I acknowledge that it is a challenge due to the nature of childcare provision, especially in informal settlements. And then the issue of mental health, the nurturing care framework probably should incorporate curriculum that addresses children with developmental difficulties, including mental health. Maybe Maggie, you could speak to this. Having mental health within the nurturing care framework as a recommendation.
Yes, I can speak to, because mental health is part of health. It comes within the aspect of health, the nurturing care framework. And of course, these days, like in Kenya, there's school mental health, and it's a big initiative that is being supported both by the health and education. So they track, they assess, they follow, they give services or counseling to kids. But I think that starts in the upper classes, not in the 3 to 5, the pre-primary, but it's a program that supports mental health and minus breaking down health into, good health means good health. So even mental health should be part of it. But you know that mental health could even fall in the child protection and responsive caregiving. So it kind of also encroaches a bit on those areas. So is this child socio-emotionally well? How is their interaction with their caregiver? That is responsive caregiving that allows development, but also allows socio-emotional well-being. And when we go to the greatest extent, that is child protection and safety, the children are not being abused. Of course, that has a lot to do also with the mental health of the child. The child who is being abused will definitely be suffering, those things. And how takes me to the question of how is responsive caregiving measured? So that has been a difficult challenge for providers, caregivers, as well as the professionals. So, but these days we know there are many efforts, initiatives that are coming up to measure, to get tools on what exactly do you measure when you're looking at responsive caregiving. Currently in Kenya, there is a program called Care for Child Development, ECD, being championed by the health sector, of course, bringing along the other sectors. And for that, it's clear what the input is, and that's what you can measure in terms of input. Is a child receiving this and that? Is the caregiver, has the caregiver been trained? How often does the caregiver play with the child? Those could be the indicators, the input indicators. And then the output indicators could be related to the developmental milestones, could be the well-being of the child. Of course, there are other contributors to those very outcomes. So we are seeing a lot of activity in that space to bring to the fore and also bring clarity to the different, stakeholders on what exactly practically is responsive caregiving. So it's very, very important question, but we are learning, and I guess these platforms will help a lot, because as Kenya is grappling with what is responsive caregiving in terms of measurement, it could be the same in Uganda or another country. So thanks to AfriChild for these platforms that can provide cross-learning across within the region and beyond. So thanks.
Thank you very much, Maggie. There's another set of questions. One, Moise says, I wish the team to elaborate more on 2.1. How do they ensure there is a relevant learning through play that doesn't become laboring to the kids? More similar to what Jude asked. What strategies are there or envisaged to have that program extend to all other African countries? I had the similar question. What do you see as the future of this? Once it's proved successful, what strategies are there to spread out to other countries? Since really from evidence, the challenges seem to cut across many African countries, at least in sub-Saharan Africa. So if you could take those two. You have already more or less talked about the first one, the learning through play, when you were addressing the issue of children with developmental delay and disability and mental health challenges. So do you want to talk about what the future looks like in terms of expanding this program to other African countries? Or is that very far along?
Can I go on that? So I think we need to look at this. Can you hear me?
Yes, we can hear you.
Yeah, we need to use a systems thinking locally and also beyond, across borders, to support sustainability locally, but also scale up within the region and beyond. So in Kenya itself, the learning through play is yet to be scaled up. But then in as much as we speak about the child learning through play, it's not only about the child and the teacher. It also means that the curriculum, pre-service curriculum has to be modified a bit to include training on the teacher. This teacher who is still learning to teach on how do you deliver using a play-based approach. And also the in-service, there are already those that have graduated in the system. How do you include in their updating courses a module or something for learning through play? So we have to look at it in a systems thinking way. And we have regional platforms like the ESC, the East African Community, and this support, the same things. I mean, I attended a conference in Dar es Salaam and they had a whole desk to support ECD. So that through such platforms, a scale up can happen, but also through collaboration. If we are collaborating with AfriChild, for example, on a learning through play kind of initiative, it's already in Uganda for that matter. So through research collaboration, but also governments should support. I know that they work through like the AU in Ethiopia, headquartered in Ethiopia, they support education across the continent. So as long as it gets those platforms, and I know that AfriChild has direct connection with such big regional platforms. So as long as important key things, get to reach to those policymakers, but of course, even locally, they should have been already communicated to the local policymakers. I guess there are so many ways to get such things scaled. Of course, when we publish our work, the researchers will pick it up. And if it's not there in one country, someone can already say, I think we need this. So there are many ways, but as long as it's disseminated, it reaches the people who need it, it can build. But we need to be more proactive than just allowing it to be passive uptake. Thanks for that.
Thank you, Maggie. And to our last question, I don't see any other questions. Our last question is really very specific. You noted both in the presentation and in your earlier comments that, and our official from government of Uganda mentioned that there's a tendency to work in silos. And in many cases, the nurturing care framework has been separated, yet it's supposed to be indivisible. Someone focuses on learning, and this is our thing, we do learning regardless of the rest. Someone focuses on responsive caregiving, and they say this is what we do without making linkages to the rest. From your experience, both in the health system and with this research and understanding that the nurturing care framework is indeed indivisible, the components are complementary and not mutually exclusive. What would you, or what advice would you give? Because most of the people online are people interested in ECD interventions. Some are designing, implementing interventions, some are regulating and providing oversight, like government institutions. What would you, could you dive deeper into how, for example, in health, we can go beyond just nutrition and physical health? Those are the two components. When we think of health in the ECD discourse, those are the two components we refer to. How can we move from that to say, okay, in health, there's also a component of early learning that's affected, because we know many of the risks, many of the issues can be modified, even in the health system. That's where life starts. That's where many of the aspects can even be directed earlier on. And not to mention the health budget in many countries is higher than many of the other budgets. And so there's an opportunity around there. Could you speak more into that and how we can practically bring in early learning aspects, bring in responsive caregiving and safety into the health space? And then that can be a good model to then go to education and say, can we bring in health aspects? Can we think of ECD as integrated in each space? Over to you.
Thanks. I see that you're really pushing for the ideal, and I think it's achievable. It's very practical because it's about understanding the needs of the child wherever you are standing. So I've just given an example in health that they are really working hard to complete the 5 areas for being burnt. And burnt could be because there was neglect of the child or the child was abused. So what is being encouraged at the moment is you treat a child, but also follow up through the social worker to see that the child, if it's neglect, abuse, you go, the social worker will visit the household. But if it needs to report to police, then the social worker can take it up, because we don't want to see that people stop coming to hospital just because they think they'll be arrested. So the multi-sectoral coordination can actually make it easy for full integration. So for a doctor, what they could do is to refer after treating for the burns or any form of physical violence, abuse, call in the social worker. So that's the bridging person. And then the other things, so they can still talk to the parents if it's neglect or abuse. I mean, if they've been skilled or educated on how to provide beyond healthcare, going into the responsive caregiving. Again, a social worker can do that, and that is based in the hospital. So by doing that, they're actually, adding another component of the nurturing care. And in education, the same can be done, but there's no way a teacher will be adding health, for example, if they are not aware about a nurturing care. So there's need for capacity building and contextualizing knowledge or understanding of what is nurturing care. What does it mean if I'm in the school setting, for example, or a daycare, childcare setting? So there is more to do in terms of, breaking that down for the different people or providers where they stand. That's the most I can say.
Thank you. Thank you very much. And that's very helpful. I like to end on that positive note that it is doable, it is possible. Could we have some parting shots from Linda, from you, Maggie? Encourage people out there who are grappling with these same challenges. Give some hope to practitioners and researchers and policymakers that are online. Over to you, Linda. Then Maggie will wrap it up.
Thank you. Thanks, Claire. Yeah, so I can say that the work we do in childcare overall, looking at the different components is important. And whatever each one of us is doing is valid. I think my clarion call is that we should strive to work together so that even as we call on policymakers not to work in silos, even us as practitioners, we should strive and build partnerships and see how we can collaborate so that we make the lives of children in Africa better. Thank you.
Thank you. Dr. Nampijja.
Yeah, thank you, AfriChild, for this very wonderful webinar and giving us the opportunity to share the evidence, the knowledge, experience, and also encourage fellow researchers and other stakeholders on this call and beyond. So what I can say is ECD is very important, and I'm excited to see that it can even take a space on a webinar like this one. I mean, I think like 4, 5, or 10 years ago, depending on where you are, you don't have ECD understood or even given a place the way it is given. I keep comparing Uganda to Kenya. Of course, allow me to say that Kenya has run with ECD. Uganda is a bit walking, but I see some pace going faster and faster. And thanks to AfriChild and whoever else on this call from Uganda who are really putting in so much. So it starts with understanding, appreciating early childhood development in some places where when you say ECD, they understand PP1, like nursery schooling. Is that what you're saying, the space? And then I'm saying, no, I mean the child and whatever they need, the food, the health, vaccination, responsive caregiving, safety, security, early learning. So we need to continue preaching that so that people get it really beyond what you do for the health. They might think, oh, I will vaccinate, that's ECD. So the holistic understanding is very important. And unless we continue preaching, we need to continue preaching, and not just preaching, support. You have the knowledge, you have the skills, show it, visibilize. I think we need to visibilize ECD. And that's why you see APHRC, when we do something in ECD, we post it there because we know someone will get to know, to see it, and then their understanding will be improved and their engagement will also be improved. But coming down, I really feel that we are in a good place. And if we are cross-learning, sharing knowledge, and also asking these questions, again, it improves appreciation and also encourages us to engage. So I want to thank everyone for this participation, and I look forward to more and more of such, us hearing now from another presenter. So thank you so much, AfriChild, and everyone on the call.
Welcome. Thank you very much for joining us. Thank you for the great presentations and the helpful insights. We're really glad that you took the time to prepare and to share with us what you are learning. Like I said earlier, what you are learning can be applied to Uganda and other contexts. So thank you for leading the way. We are to keep the conversation going. There's a lot happening on the continent around early childhood development. We had a childcare conference in Addis. There was one in Rwanda. There's one in Nairobi. There's a lot happening. And so it's an opportunity for us to take advantage of the momentum that's already on to advance the cause of well-being for children. Very much for joining us. Please look out for the webinar at the end of the month, the last Tuesday of this month, 30th September. It will be talking about teenage pregnancy and childhood sexual violence. We'll be looking at what is working in our communities, what in low resource settings, what innovations are in place to address childhood sexual violence and teenage pregnancy in Uganda, both rural and urban settings. Look out for that. We'll share more information later. Thank you very much. Keep the conversation going on our different pages. Thank you, AfriChild team, the communications team, and IT for hosting this webinar. Have a good day or good night, depending on where you are.
Bye.
Bye.